So, gentlemen, let me bring you back to the topic on capabilities. I think we've heard just now that the crisis has really heightened, right? The number of vulnerabilities that's happening over a very short time, and yet still the demand for cybersecurity capabilities has shot up, and it's a scarce resource, right? So how do you overcome that challenge? Is it through automation or any other means? Linus?
I would say it's a number of ways. First of which, you still need people, right? We have the advantage, I guess, as IHH, because of our footprint, to in fact source internationally. And because of our presence in India, we've actually managed to source some resources out of India.
Okay.
So that helps a little bit. Okay, but you still need local people.
Right.
And that's where we then look at who are the key partners that we can work with and identify them, and people who are willing to have an open conversation in that it will be a dynamic relationship, right? Where at a certain time we'll tap more on them. Other times we expect them to do some knowledge transfer so that we will have the capability to build up ourselves. So that kind of adjustments. But we are definitely looking into technologies and tools that are evolving, where in the past a lot of the cyber technologies and defenses we have were very static, and you just wait for the next signature patch, or when there's a problem, you kind of rush them to give you a patch. But increasingly we're seeing technologies that are coming out that have embedded intelligence into it, where it's more of looking out for patterns. I'm no expert in this, but I think increasingly a lot of these are beginning to really apply themselves into a very much maybe not exactly the same, but more on a zero trust environment. If something just looks out of the norm, you don't trust it. You just clamp it down first, ask questions later. Right? In the past, it's let it through, then ask questions later. So now we just kind of turn it the other way around. So that's something which I guess is a mix of people and capability and technologies that we're evolving to adopt.
Right. So Linus, you have pointed to this thing that's being floated around these days about overall orchestration. I think organizations who have invested in comm security in the past and yet still have to evolve their investments in new technology has to have some form of orchestration. Leonard, would you like to share some of your views about this?
Yeah, I'd be happy to. I think you're right. Skills shortage in cybersecurity is undisputable fact. It's been going on for a few years, right? And there are a couple of ways of how do we do that. One is for us to turn on to automation. So it means that instead of doing things manually, like doing patching manually, looking at alerts, responding to anomalies, as you mentioned, we try to do it as automated as possible. And this whole topic is a big domain called SOAR, security orchestration and response, right? But the good news is this. We know that it is difficult, it is complex, but you don't have to do it yourself. There are a lot of security services companies that could provide such service for you, right? So you could, your requirement for the manpower, as Linus mentioned, you need someone inside the organization, but instead of having 100% of requirement, you could have only a fraction, and you leverage on these companies that are able to provide that automation orchestration. And for example, my organization also worked to help the medical healthcare organization to monitor their operate their medical equipment security, because we know that not many clinics or healthcare companies have the capability, and those that commercial services may have a slightly more angled skew to the enterprise security rather than medical security. So you can turn into that. And we work closely with the solution provider that really provide the solution that we can deploy to the to protect the healthcare organization. Perhaps at this point, I would like to turn it over to Alvin. How do you help to protect the organizations?
With any protection strategy, you need visibility. And in today's environment, we see more and more ubiquitous, solutions having IP connectivity to the point that you said about OT and so on and so forth. So we need to see and register to make sure that these are company-approved devices so that we can mitigate against shadow IT or mitigate against a potential threat that's coming in to steal data. Once you have visibility, it's easier to drive automation and it's easier to drive orchestration, because now you have that clarity from a device level, what's present. You map that to your business workflow.
Right.
And then you look at the entire process. So anything that doesn't fit there becomes, to your point, zero trust. I don't trust. I think something is wrong over there. I don't allow it from happening. And that's just one of the simple ways that we can look at, that we can partner and deliver to our customers. But we also need to bear in mind that this automation process and orchestration process is not something that we do and we wash our hands. It's something that we also need to babysit.
Yep.
Because its effectiveness stems on the way that your company runs. And your company's processes are not stagnant. They will change. So when that change happens, or when a merger and acquisition happens, you need to relook at all of this again and then say, are these the right processes? Is this the right set of automation? Otherwise, the automation is no longer valid. Yes, automation delivers a tremendous benefit, especially with such limited, skilled resources. And you allow those skilled resources, those limited resources, to elevate themselves, to take a bigger and more important role. One of the things that I find with many organizations, to the earlier point that you talked about with the clinics, is the mindset: if it's not broken, don't fix it. It's a mortal sin in cybersecurity, because if it's not broken, you don't fix it. It's a known process. It becomes outdated. It becomes obsolete. Although it's still delivering the services, it then becomes a vulnerability in your entire value chain. And that's a point of entry. So it's not just the people that we are thinking about. It's also the devices that you have. It's also the smaller clinics that are downstream or upstream of your entire care services that plays that importance. So it's holistic cybersecurity, not just point cybersecurity. Right. To your earlier point that you talked about, the whole thing about acquiring more and more technology. I find that speaking to a lot of CIOs, when they talk about the business and everything, one of the key challenges they have is, how do they articulate the business value of cybersecurity to the boardroom? And how do they, stop themselves from keep buying technology for the sake of buying, so that, they feel better. It's no longer that. It's all about knowing what you need, aligning it to the business, protecting your business, delivering the business outcome. Digital transformation is all about business outcome. Cybersecurity should also evolve and look at the business outcome that they want to deliver. Protection of customer data, mitigation against medical services, and better customer care in the shape or form that the customer wants it.
Okay. So Linus, based on zero trust strategy, I think you mentioned, and Leonard as well, I think Alvin, you also added your views about it. There is some belief that zero trust strategy could also mean air gapping, right? So, we've heard this term where, you just isolate, right, your operational day-to-day with the internet altogether, right? Is that something that you would prescribe?
It's not possible to do it in a sustained. You can selectively do it in some locations, but it's impossible in today's world for you to say, well, I'm just going to cut myself out altogether.
That's right.
Because we just spoke about it throughout this session.
Right.
It is all about transforming the entire care delivery process in the hospital, after the visit to the hospital, before and after the visit to the hospital or clinic, and in between the visits to the hospital, in the person's home and all that. And how do you keep engaged? So that whole ecosystem, if you're going to isolate yourself, it's just not going to work. Right. So it's not possible. So the question really then is that how do you balance that? And what you said is exactly right. We need to understand the business processes.
That's right.
How do you bring that value conversation into the boardroom to say that this is all part and parcel of it's table stakes? Right. If we're going to be in business to be ready for the future, we need to do these few things. But underlying all of that, cybersecurity and secure processes, practices, tools must be embedded. It's not an afterthought.
That's right.
So how to build it all in. So in fact, we've just been talking recently at a group at the board level that moving forward, we need to embrace the digital ecosystem because that's a different way of engaging with the patients and all the stakeholders in future. Right? How do you engage in the digital ecosystem? We must digitize what we do. So what used to be pen and paper, for example, as you mentioned, has to be digitized. But it's not just about asking the doctor, rather than writing out notes, you type it in the computer. And after that, the process doesn't change. You print it out, pass it to your nurse, and the nurse go and prescribe or something like that. You have to then look at digitalizing your business process.
Exactly.
So all three has to be done together.
Right. Yeah.
And when doing all that, you collect so much data, and then what do you do with that data? So you need to create mechanisms to add value to the entire ecosystem with that data. So we're calling it intelligence.
Yeah.
But when you do all that, you must make sure it's all protected, it's secure. And for healthcare, fundamentally, you mentioned earlier, why do I go back to the doctor that I like? I trust the doctor.
That's right.
Yeah.
Underlying everything is
trust.
because I trust the person, the doctor, the hospital, the clinic I go to. And for us, all these things must ensure that trust is maintained, is heightened and leveled up even more. So that's putting it all together fundamentally for us.
So interesting, Linus, I see you in one sentence, you bring the word trust, and then you also bring in the part about embedding, right, security in terms of the services in which you provide. So Leonard, in terms of the medical technology that you are involved in GE, right, how does security by design come into play?
Yeah. So I think bearing in mind that the medical equipment that we manufacture has a long life cycle, so it's very important that those that we provide to the market is secure out of the box, because they will be used for 10 years, 15 years. But bearing in mind also that the threat will be very different. If we can mitigate all the threat today, it doesn't guarantee that we can mitigate the threat in the future.
Yeah.
So I think there's so much that we can do from product security point of view. But then again, when we implement or deploy the medical equipment to the clinics or the hospital, then it becomes the operational security. How does the hospital maintain the security posture of that device? So I think, as Linus mentioned, it's ecosystem. We have to work together as an ecosystem. But I would like also to bring out the future possibility of medical devices, or the micros one, like our smartwatches that tracks the way we sleep,
The wearables.
heartbeat, wearables,
Yes.
our blood sugar, blood oxygen level, and a lot of things, right? And all this data must be collected not for my entertainment, but rather for something which is useful for the medical professional to determine my health posture. What can be done? And coming back to your question about no trust or zero trust. Zero trust is not no trust. It's just that you are continuously validating the trust.
Right.
Whether we trust data source. We do not want the data source to pollute or to make a noise to the overall diagnosis.
Right. So Alvin, I saw you shaking your head when Leonard mentioned about continuously ensuring, right, that you have this zero trust strategy. You must have had something in your mind when you're thinking about
actually,
that.
I have a lot of things in my mind, but it actually fundamentally boils down to this. It's all about visibility. It's all about continuous monitoring.
Right.
It's all about mapping the level of risk that you're willing to take against the business model that you have.
Right.
Once you are clear with all of that, right, then you can operate with some level of confidence that you can maintain consumer trust, patient trust. You need to look at what lens you're looking at. Zero trust is something that a practitioner would look at, not something that a patient would look at. So this is where I think we really need to be mindful that when we bounce some of these things around, what lens are you looking at from?
Right.
If I'm a patient, what kind of trust do I want? I want to trust the professional advice that's given to me, that's accurate, that is for me, there's no mistake, that my data has not been modified by somebody, right? So that it can impact me. For example, if I'm looking at from a medical practitioner perspective, I want to trust that the systems are there to enable me to do the best possible service that I can give to my patient so that he enjoys and he continues to trust me as a doctor. If I look at systems, I need to have the trust in the system that everything is flowing as per properly, that the medical device are not compromised, there is no man in the middle, there is no data exfiltration in the process, there's no shadow IT or people siphoning out information and modifying information that impacts my entire workflow for me to deliver the services to the doctors, and from the doctors for them to send those necessary prescriptions to the pharmacies for them to deliver that to the patient. So it's an ecosystem to what Linus and to what Leonard has said. It's everybody working in collaboration, but with one common goal. And that common goal is the business outcome of delivering better medical services to the patient.
Right. Okay. So gentlemen, it's really good within this short while. I think we have touched on different aspects. Maybe as a concluding question, I would like to hear each of you sharing your insights on resilience and agility, right? I mean, the crisis, if there's anything else, has taught us that we have to move quickly, we have to make our decisions fast, and we hope to get outcomes that serve whatever sectors in which we are in. In particular, I'd like to narrow it down to the healthcare sector. Okay, so maybe we'll start off with Linus. What is your definition of agility and resilience in the healthcare services?
What I think for healthcare resilience and agility is that we are able to quickly respond to the market demands and the jurisdiction changes and how the whole COVID situation changes, and be able to change the way we work. At the same time, what's most important, I think, as I mentioned about trust just now, is also about having that level of trust with our employees and the people delivering care. Because then the whole organization can respond in a very agile manner and be resilient to the changes that happens around us.
Right.
So I think that's really how I see the healthcare organization needing to respond to this.
Right, okay. And Leonard, what about you?
Yeah, I think healthcare is really important because at the end of the day, the stake is people's life and quality of life. So I think it's really important. We have to be resilient. There are a lot of risks with the digital transformations, but we have to overcome it. And I think the greatest message I would like to share with everyone else is really, let's move on with digital transformation, but we also have to look at these risks, the security posture, as well as the resiliency, as you mentioned.
Right. So Alvin, especially based on what Leonard has just said, from a cybersecurity posturing point of view, what are your views?
Well, cybersecurity cannot create friction. In order for them to be resilient, right, and for them to be agile, we cannot be the cause of saying, stop, no, you can't do this because, you can't do that because. We must be adaptable. And in that process, right, be able to enable them to drive the necessary programs while protecting them so that they can do what they need to do. We support them, we protect them, and we enable them.
Thank you, thank you. So gentlemen, it was really a very interesting discussion. I think you all did justice to the topic about delivering secure and resilient digital services in the healthcare sector. So, and I think we managed to peel the layers. I just wish that we had more time, but thank you very much for your views and your insights. Thank you everyone for watching this series of #Unplugged. Another interesting discussion. See you soon.